Hello, everyone. My name is Courtney Blakey, and for the purposes of this assignment, I will be discussing tuberculosis in the correctional setting. Okay, I'm going to be, for the purposes of this assignment, I'm going to be teaching a group of new nurses to the correctional facility, both the prison and jail system, and going over tuberculosis, the bacteria, explaining what it is, explaining prevention and control methods, susceptibility, and other issues concerning tuberculosis in the correctional setting. So tuberculosis is a potentially serious infectious disease. It mainly affects the lungs, and it is spread from person to person when tiny air droplets are released into the air from either coughing, sneezing, talking, anything of that sort, and a person inhales them and becomes infected by the bacteria. Some of the signs and symptoms of tuberculosis are blood-tinged sputum, fever, unexpected weight loss, night sweats, and fatigue. So in the correctional setting, when we have new intakes, which are people that are either coming from fresh off the street into a jail, or they are transferring from a jail to do their prison sentence. Correctional nurses are responsible for doing the initial assessment. So you want to have a tuberculosis questionnaire. Most of the time it is a standard piece of a standard form for each facility. And they may ask questions like, have you traveled outside the country in the last 7 to 14 days? Have you been in close contact with someone who was suspected of having tuberculosis or confirmed that they had tuberculosis? Have you had any recent unintentional weight loss? If so, how much? Do you have any night sweats, any fever, any chills that cannot be attributed to another disease process? For the correctional setting, a lot of times the offenders, which are what we call the inmates, are in close quarters, meaning that they are in overcrowded living conditions, and that makes it easier for a disease like tuberculosis to breed and to spread throughout. And so in order to prevent an increase in exposure, what healthcare providers and nurses are responsible for doing is to do the screening process, and within 24 hours of an offender arriving to a facility, if they have not had a PPD done within the last 6 months, what they do is to place a tuberculin skin test, which normally is via a PPD, which is a purified, a purified protein derivative. It's placed intradermally, and the test results are normally read anywhere from 48 to 72 hours at the latest. A PPD not read within the 72 hours must be repeated. Okay, let's see. So when prisoners come into the correction facility, they go through their general intake, and then if they're medically stable, they are normally placed into general population, which is more like a college dormitory type environment. They have shared bathrooms, shared dining quarters, and they're able to basically move about the facility without any restrictions. However, as far as a medical standpoint goes, as far as for people who have been in close quarters with someone who's tested positive for tuberculosis or have tested positive for TB, or have been out of the country, they are quarantined in a negative pressure room, and healthcare staff are required to don and gown N95 face mask, gloves to come in contact with that person to limit possible exposure. Let's see. A lot of the prison system is made up of people who are immunocompromised. A lot of the times, people who have had substance abuse issues, or they are currently off medications due to not being able to financially afford them due to maybe recent incarcerations and then release and recidivism, meaning that they are repeat offenders and come back into an institution. So a lot of times, or homelessness, people who combat homelessness, all of these things increase the chances of exposure to tuberculosis. Let's see. One of the things that we must be mindful for in the prison system when conducting tuberculin skin tests is that all needles and sharps are accounted for. All vials of medications must be properly stored. They must be placed away in an area where they can be accounted for, and offenders do not have access. So just making sure that once a nurse has completed their tuberculin test, that proper destruction is accounted for, as far as signing out all needles, properly disposing of the needle in a sharps container, as well as being mindful when given injections, how many needles you have, that offenders don't have a chance to take a needle or a sharp without your knowledge and take it back into their living quarters and inject themselves, or give the needle to someone else to inject themselves with something that could be potentially dangerous. And what else? Another thing that we should discuss is that both local and or state healthcare agencies should be notified if a patient does test positive to having tuberculosis, and that patient must be identified, isolated, and treated. And that is all for the purposes of this video. I hope you enjoyed. Thank you.